Alright, hi guys, my name is Katherine Kurtz and my presentation is on STIs in teens, the teacher's role. Alright, so why is this important to know? So teaching our students about the dangers sex can bring is an important part of raising teens who will make safe and educated choices about their body. The US has the highest rate of STD infection in the industrialized world, which is pretty crazy. And STDs can be life-threatening or cause other severe health complications if left untreated, yet less than half of adults age 18 to 44 have ever been tested for an STD other than HIV/AIDS. So that's something pretty concerning, which if we educate students that they might test more and make better choices. So how are STIs affecting our teens? So 1 in 4 teens contract an STI every year. Young people 15 to 24 years old account for more than half of new STIs, yet only account for 1/4 of the total population. Now this shows that teens are engaging in risky sexual acts due to either lack of knowledge or poor decision making. Luckily, as a teacher, we can help solve one of those problems by teaching them and giving them knowledge. STI statistics show that among teens having sex, approximately 1 in 4 will contract an STI prior to reaching adulthood. The most common STI that affects teens is chlamydia. However, only 3% report being tested for this STI. So are teens getting safer with sex? So the studies are indicating that we are seeing a decline, and basically we've seen an overall increase in condom use, but in recent years there's been a bit of a decline in condom use. So that could be due to a number of things. Condoms are not a get out of jail free card, which is important to know because there are issues with condoms, or you could use them wrong, or you could get a STI in another way. So which teens are especially at risk? The CDC reports that teens identifying with the LGBTQ community are at a significantly higher risk for contracting STIs. Of the young people 13 to 24 years of age who are diagnosed with HIV, 81% of them were gay or bisexual males. Statistics show that minority students are more likely to get an STI than white teens. Poverty, income inequality, unemployment, and low educational attainment were also identified as risk factors for STI contraction. This means that students in low-income areas are more at risk for STI contraction. So why do we as teachers need to undertake sexual health education? So only about 43% of teenage females report discussing STIs and STI testing with their healthcare professionals during checkups, and only about 27% of teenage males report discussing STIs and testing with their healthcare professionals. So this shows that teens are just not getting the information from their doctors, and if they're not comfortable talking to their parents, then the next best source is you, their teacher, and oftentimes they'll trust you and view you as someone who's educated, which you are. All right, thanks guys. These are my references.